Psammoma bodies. Hi everyone, today, we're going to explore an interesting and important microscopic finding in pathology, the Psammoma bodies. These tiny structures can tell us a lot about the underlying pathology, both malignant and benign. So let's dive right in. What are Psammoma bodies? A Psammoma body is a microscopic, round structure made up of concentric layers of calcium deposits. The term Psammoma is derived from the Greek word psammos, meaning sand, because under the microscope, they resemble small grains of sand. Psammoma bodies are most commonly seen in damaged tissues, and while they are frequently associated with malignant cancers, they can also appear in some benign conditions. What type of calcification is involved? Psammoma bodies form through a process called dystrophic calcification. This means calcium builds up in areas of tissue damage or necrosis, even when blood calcium levels are normal. Structurally, they show concentrically layered deposits, which gives them that signature lamellated or onion skin appearance. What are Psammoma bodies made of? Psammoma bodies are primarily composed of two components: calcium phosphate, the main mineral component, forming microcrystals similar to those in bone. Collagen fibers. These fibers provide a structural framework within which the calcium deposits are laid down. How do Psammoma bodies look under the microscope? Under light microscopy, Psammoma bodies appear as round, well-defined calcifications, with a characteristic onion skin pattern. Composed primarily of calcium salts, these structures exhibit a dense, layered architecture and are typically spherical in shape. Are Psammoma bodies eosinophilic or basophilic? Psammoma bodies are basophilic, meaning they stain blue or purple with basic dyes, like hematoxylin. This basophilia is due to the high calcium content, which binds readily to those dyes in standard H and E staining. What do Psammoma bodies indicate? Psammoma bodies typically form in areas of tissue injury or degeneration. While they are often linked to malignant tumors, they may also appear in non-cancerous, benign conditions, so their presence alone does not confirm malignancy. They must be interpreted in context. Psammoma bodies popular mnemonic. PPSSaMMoma. The popular mnemonic for conditions associated with Psammoma bodies is PPSSaMMoma as PPSSaMMoma, which stands for papillary carcinoma of the thyroid, prolactinoma, serous ovarian tumor, somatostatinoma, meningioma, mesothelioma. To wrap it up, Psammoma bodies are tiny but significant structures in pathology. Their unique appearance and specific associations make them valuable diagnostic clues. However, it's important to interpret them alongside other clinical and histological findings. Thank you for your attention.